Let's go through the video answers for question set 24. First question, a 53-year-old man has just been diagnosed with peptic ulcer disease visualized on endoscopy. Ranitidine and lansoprazole are the medications available on your hospital formulary for the treatment of peptic ulcer disease. So describe the different ways in which ranitidine and lansoprazole decrease parietal cell acid secretion. So ranitidine is an H2 blocker. It is blocking the H2 histamine receptors. Now normally histamine activates these receptors, and that triggers a signal that stimulates the luminal hydrogen-potassium ATPase pump to start pumping hydrogen ions into the lumen of the stomach. So antihistamines are going to reduce this stimulatory signal, and you're still going to be able to make some gastric acid, just not quite as much. Then lansoprazole is a proton pump inhibitor, or a PPI. These drugs actually go right to the source and they shut down that hydrogen potassium pump. So they're much more effective at completely shutting down acid secretion. So the next part of the question is, why is ranitidine preferred over cimetidine? They're both H2 blockers. The short answer is that cimetidine has lots of side effects. So cimetidine inhibits cytochrome P450 enzymes. That's going to cause a lot of drug-drug interactions. Cimetidine can also cause some anti-androgenic effects that can cause gynecomastia in men. Cimetidine will cross the blood-brain barrier, so it can cause CNS effects like dizziness and headaches and even some confusion. Then the next part of the question, what other conditions can you treat with lansoprazole and ranitidine? So in addition to peptic ulcer disease, these drugs are also used to treat gastritis, esophageal reflux, and Zollinger-Ellison syndrome. So all diseases where you want to suppress gastric acid production. Next, how much does the H&H change in a person that's acclimatized to a hypoxic environment for weeks? So when you go from sea level up to, say, base camp at the foothills of Mount Everest, you're going to need some time to acclimatize to the altitude and to the low oxygen tension. And during that acclimatizing process, the hematocrit goes from 40 or 50 up to about 60, and then the hemoglobin goes from 15 to about 20. Next, Wallenberg syndrome is an injury of the lateral medulla that presents with a constellation of neurologic symptoms, including difficulty with swallowing or dysphagia, hoarseness, and difficulty with palate elevation. So which part of the lateral medulla is responsible for swallowing and palate elevation? Well, it's the nucleus ambiguus, which gives rise to the efferent motor fibers of the vagus nerve, or cranial nerve 10. And then what other cranial nerves can be involved with this region? The other two cranial nerves that receive inputs from the nucleus ambiguus are the glossopharyngeal nerve, cranial nerve 9, and the spinal accessory nerve, cranial nerve 11. Next, what are some extrapulmonary causes of restrictive lung disease? So there are lots of pulmonary diseases that cause restrictive lung disease. Things like pulmonary fibrosis, or Goodpasture syndrome, or even drug toxicity that damages the lungs. But this question is asking about extrapulmonary causes of restricted lung disease, things outside the lung. So obviously obesity is a big one, because fat can literally compress the chest and restrict expansion of the lungs. Other mechanical or structural problems would include scoliosis or severe kyphosis from osteoporosis, because if that spine is curved, then the chest can't expand normally, and that's going to restrict the lungs. And then another group of disorders would be neuromuscular diseases that weaken the muscles of respiration, like the diaphragm. So myasthenia gravis is a classic example of this. Another one would be polio. That's why those patients end up needing a lot of ventilatory support. Next, what are the essential amino acids? So essential amino acids are amino acids that have to be supplied by the diet. Your body can't produce these. So the mnemonic for the essential amino acids is Private Tim Hall for phenylalanine, valine, threonine, tryptophan, isoleucine, methionine, histidine, arginine, leucine, and lysine. And one note on those is that arginine is normally only essential in children because they're not able to synthesize enough arginine because they're growing, so their bodies have a very high demand for arginine. But adults can generally synthesize an adequate amount of arginine. Next, what muscles compose the rotator cuff? So the mnemonic for the rotator cuff muscles is SITS, for the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Next, what mature structures arise from each of the following embryologic structures? These are all parts of the heart and the cardiovascular system. So the bulbus cordus gives rise to the right ventricle and the outflow tracts of the left and right ventricle. The left horn of the sinus venosus gives rise to the coronary sinus. The primitive atrium gives rise to the fibrous or trabeculated portions of the left and right atria. The truncus arteriosus gives rise to the ascending aorta and the pulmonary trunk. The primitive ventricle gives rise to the fibrous or tuberculated portions of the left and right ventricles. And then the right horn of the sinus venosus gives rise to the smooth part of the right atrium. And the right common and anterior cardinal veins give rise to the SVC. Next, what medications are commonly used for the treatment of insomnia? So there's a long list here. There's melatonin, which is available over the counter. It's non-addictive. A lot of patients use antihistamines like diphenhydramine, which is Benadryl. It's also found in Tylenol PM and Advil PM. The problem with antihistamines is that these drugs give a really poor quality of sleep. They're certainly not a good idea for long-term use for insomnia. There's a drug called trazodone, which is an antidepressant. It actually increases REM sleep. Occasionally you'll see older antidepressants like tricyclics used for insomnia, things like amitriptyline. Now there's a small risk of arrhythmias with this drug, and these drugs can be dangerous if the patient overdoses, so that's not a great idea. There are long-acting benzodiazepines like temazepam or lorazepam. The biggest problem with these is that they're potentially addictive. They're really only recommended for short-term use, less than about 35 days. And then some of the most common insomnia drugs are zolpidem and zaloplan. Now zolpidem sold under the brand name Ambien. I'm sure you've heard of that. Both of these drugs act at the benzodiazepine receptor, but they're a little bit safer. They don't really have potential for addiction, but they can cause some rebound insomnia when you stop using them. Now, lots of people use these drugs chronically, even though they aren't technically approved for long-term use. But there is a controlled release formulation of zolpidem that is approved for long-term use. And there's isoprene or Lunesta, which is also approved for long-term use. And finally, there's a drug called Ramelteon, which acts at the melatonin receptors rather than at the GABA receptors, the benzodiazepine receptors. So there's really no risk of addiction with that drug either. Next, a 50-year-old man crashes on a motorcycle on the highway and sustains a right anterior hip dislocation and knee trauma. Now, he cannot adduct his hip or plantar flex on that side. So which nerves are injured? So the obturator nerve is responsible for hip abduction, and it's commonly going to be injured in anterior hip dislocations. And then the tibial nerve is responsible for plantar flexion, and it's commonly injured with knee trauma. And our last question, describe the rash presentation associated with each of the following diseases. So with rubella, the rash is going to begin on the head, and then it's going to move inferiorly. With herpes zoster is shingles, right? So the rash of herpes zoster is characterized as grouped vesicles on an erythematous base in a unilateral dermatomal distribution. Definitely need to be able to recognize that. HHV6 gives a macular rash over the body that appears after several days of high fever. That's usually going to be seen in infants. Parvovirus B19 gives the classic slapped cheek rash at first, and then later it appears over the body in a reticular or lace-like pattern. Coxsackie virus type A causes a vesicular rash on the palms and the soles. It also causes ulcers in the oral mucosa. Then strep pyogenes can cause an erythematous sandpaper-like rash accompanied by fever and sore throat. So that's it for set number 24. We'll see you next time.